There are different types of gait in CNS, okay, which implicates some different disorders. So first is a hemiplegic gait. If there is a unilateral hemiplegia one side, then they will have a circumduction gait, that is hemiplegic gait. I will show how circumduction gait will look like. Okay, right. The patient upper limb will be adducted, flexion at the shoulder joint, flexion at the wrist joint, and pronated. This is the upper limb. The leg, because of the adductor muscle hyperactivity, if he wants to walk, he will take a circle, circumduct, and then he will bring it back. Okay, now I will show. Okay, so this is a circumduction gait. He will take a turn like this, and then he will. Again, I will show from this side. Arm will be adducted, shoulder will be, the elbow will be flexed, pronated, wrist will be flexed. Okay, then he will walk like this. This is a circumduction gait. Now, if there is a bilateral UMN affection, so then they will have bilateral circumduction. Okay, because of the adductor muscle hyperactivity, there will be a scissoring gait. One leg will cross in front of the other. I will show how it will look like that. So, how the scissoring gait will look like, I will show. So, usually they will have bilateral hemiplegia. Okay, so then the one leg will come in front of the other. There will be a circumduction gait and there will be a scissoring gait like this. So, I will repeat. So, there will be a scissoring gait. Okay, like this. Once more you want. So, in the scissoring gait, both the legs will cross. So, students, the next is Parkinson's gait. It is a short shuffling gait. With the short steps they will walk, and they will walk fast so that they are as though they are trying to catch their own center of gravity, festinant gait. Okay, so how a Parkinson gait will look? So there will be decreased arm swing, and then they will move with a very short steps like this. That is Parkinson's gait. I'll repeat. So they will walk with the short steps and stooped posture, and decreased arm swing will be there. Okay, this is a Parkinson gait. So next is high stepping gait. There are two types in high stepping gait. Okay, one is due to sensory ataxia and another due to a foot drop. Okay, in sensory ataxia there is a posterior column problem. He will lift the leg height and then he will stamp it on the ground. Okay, he will stamp it on the ground. Whereas in a foot drop, he will lift the leg height, but the front portion of the leg will touch first and then the heel portion. Both are high stepping only, but the sensory ataxia gait is stamping gait. Okay, and here in the foot drop, the front portion of the foot will touch the ground first. In a sensory ataxia, he will walk looking at the ground. He cannot look front and walk because he needs sensory stimulus from the ground for his walking. And if you ask him to if you ask a patient to walk backwards or with the eyes closed, his ataxia will be aggravated. So high stepping gait will be, so they'll just lift the leg height and then they'll walk like this. So they lift normally, how much will lift? They'll lift more than that and they'll walk like this. That is a high stepping gait. Then you have ataxic gait. Ataxic gait is seen in cerebellar disorders. There will be reeling and lurching of the legs. You get in alcoholic, multiple sclerosis and other affection, the hereditary ataxias, you get ataxic gait of cerebellum. Then if proximal muscle weakness of the hip girdle is weak, then they will have lumbar lordosis and waddling gait will be there. Okay, right. So then you have the functional gait disorder, that is known as estasia abasia, also known as block syndrome. That means the patient can jump, hop, he can walk on all the four limbs, but he will say that he has inability to stand upright, to sit upright, that is astasia, and to walk properly, that is abasia, that is block syndrome. To stand upright, that is astasia, to walk proper, that is abasia. So he can't walk properly, that is abasia. Astasia is unable to stand properly, that is blocks him, functional gait disorder, that is. So which are all the gait disorders? Circumduction gait, scissoring gait, Parkinson's gait, high stepping gait, there are two types. Okay. Then sensory ataxia. Now there are some diseases which produce a combination of the gait disorders. For example, if there is a subacute combined degeneration, so there is affection of the corticospinal tract as well as posterior column. So there is spastic gait plus ataxic gait. Same like multiple sclerosis can affect the posterior column, corticospinal tract, ataxic gait, spastic gait. There can be a bilateral foot drop in motor neuron disease, peripheral neuropathy, there can be a bilateral foot drop, and Charcot-Marie-Tooth disease, there can be a bilateral foot drop. In motor neuron disease, there can be a spastic gait plus foot drop also because of the muscle weakness of the distal muscle weakness. In a severe sensory peripheral neuropathy, there can be a mixture of ataxic gait because of the posterior column involvement, there can be a foot drop also, there can be high stepping gait. This is the combination of the gait disorders which you can get. Okay, right. Now, so we examined till the gait disorder.